Hello, this is Sherman Blackwell, and welcome to this week's program presented by Singing River Services. Thank you so much for joining us today. I am so delighted to have our guest today on the program, Debbie Brockaway. Debbie is no stranger to Singing River Services. She has been there for over a decade now and is our regional children's coordinator and is doing an excellent job. And Debbie, welcome to the program.
Thank you very much.
Always
glad
good
to be here.
Always good to see you and have you here with us. There are a lot of things that are happening when we deal with children, and you deal with particularly when you're dealing with mental health, or particularly behavioral issues, conduct disorder, those kinds of things that are kind of taking off, ADHD, ADD, and those kinds of things that kind of announce themselves pretty early on in a child's life. First of all, since we're back here on Channel 7, let's remind the audience here of just exactly, well, let me start with this. Tell me a little bit about why and how you got involved in working in community mental health.
I grew up, my grandmother worked with individuals with disabilities my whole entire life, so I was no stranger to that. So I just grew up knowing that that was a field that I would be interested in, and I just pursued it, and here I am.
Here you are, right. I know that Debbie has a master's degree and in this field, and has been working diligently. You've done a lot of things. Of course, you're primarily, even though you're the regional children's coordinator, you work out of our George County office, yes, which is stationed there in Lucedale. And you've done a little bit of everything. I know you came in as case manager, adult case manager, and did several things along those lines. Of course, Carla Brooks, who is the satellite director up there and does a great job, she was quick to recognize the potential that you have and the diligence that you have. And there's a lot of hard work. And in our George County area, since Katrina, we've seen growth.
We have.
We've seen a lot of people have changed. A lot of people have moved from the coast, and there was a lot of growth up in that area. There's a lot of new industry in and around that area. I know over like in the Mobile County area, and so there are a lot of people, and a lot of people in George County, primarily still, I guess, an agricultural community.
It is.
But there's phenomenal growth. Seems to be every time I go up there. There's a new subdivision, so people live and do a lot in George County, and that's something that, even though you here again you do work out of our children's regional coordinator, so you're responsible for both Jackson and for George County. We have seen, Debbie, we've seen a lot of changes that have gone on in the service delivery end of community mental health. I've mentioned on this program some of the changes, and of course a lot of changes have come to Mississippi. And of course, when you couple that with an economic downturn, you couple that with a lot of issues and stressors that are going on. You know, we don't live in an isolated community anymore. We're affected globally.
Exactly.
By the price of gas and by all of these kinds of things. And people think, well, you know, those things add up and really begin to stress family. And when you talk about children's and you talk about focusing in on children, you know, a lot of times that includes working with the family.
That's it.
In addition to that. And I heard this new phrase that tells you how dated I am, tweens, not too long ago, which meant not a teenager, but I guess in between, starting like in the 6th grade, 12 and 13 and 14. You were a case manager, you're over that. And though this audience is somewhat familiar, I guess, with the changes that are coming, where do you see the biggest changes that are happening when we talk about community mental health? And I remind our audience that we are an outpatient facility. You know, we deal with outpatient. We don't do any inpatient services of a crisis nature or anything like that. So in your 10, 11, 12 years now, how have you seen the changes and the changes that are coming affect what you do specifically?
Well, it limits our ability to provide services that these children need, the children and their families. Case management, for instance, there's a time limit on it now. I think it's like an hour and a half. And when a child or a family is in crisis, you know, you just can't predict that, you know, you can see them an hour and a half and you're going to, you know, help with the situation, because that's not always true. Our case managers go to IEP meetings with these children and the families that's desperately needed. Those IEP meetings last longer than an hour and a half at times. But, you know, there's a limit on what, also there's a limit on day treatment. We're having to go through a process to get these children pre-approved with somebody outside of our agency. It's just not our doctors that, you know, are saying, yes, this child needs day treatment. It's not up to us. It's an outside agency that's never laid eyes on these children. So, you know, there's a lot of changes.
Right. Let's talk about, you say day treatment, and for our audience, let's define what that is, and then we're going to talk about how that is changed.
All right, day treatment is an extensive outpatient therapeutic environment. It's done in a group setting. At least 4 children, no more than 10. They work on things like social skills, anger management, just those skills that they need to be able to stay in that classroom, in the community. It's an intense program. It's at least 2 hours up to 5 hours per day. This service is desperately needed, and there's a limit on what they can, the services they can receive.
Whenever we talk about that now, you know, it's not like we're sitting here and saying, well, that's great, you know, all this, you know, we wish, you know, it'd be great if we were in some other business.
Exactly.
You know, but the reason people get in this business is to help folks, and when you talk about doing intervention and changes and assisting families, many times when we talk about children, where do a lot of these referrals come from? And it's not like we're going around, you know, looking for folks. The
schools is number 1 referrals. Schools is our number 1 referrals, which means by the time they call me, they have exhausted most of their means. And of course, we do have parents that just don't know what else to do. You know, they're at a standstill. They don't know where to go for help. So right. they will bring them in. But most of our referrals come from the schools.
Because a teacher may have a classroom of 20 folks or children from various ages. Then you're going to have a child in there with a behavioral conduct, hyperactivity, and those kinds of things. It's hard to keep control of a classroom if you're anybody that has dealt with those kinds of issues, and teachers want to teach.
Right.
They don't do therapy.
Right.
You know, in an ideal, perfect world, and so that's when many times I know you have a great relationship with the schools in Jackson County, and George County, but George County particularly. What do? They call you, and what happens in the event? Because it really is kind of late in the game, and you know, we kind of come in after the fire's already gone.
Right. They'll call and let us know that there is a child that they would like to refer to be evaluated. Of course, the parent knows about this ahead of time, and we get with the parent and we set up a time for that child to come in, and we just move forward from there. We do an intake, and he or she sees the doctor, and we make an assessment at that time on what services that is needed in that particular case.
And that brings us back to the other point that we were going to make earlier, how things have changed. If a child is referred, give them the process, and then that used to be enough, and now how has that changed?
Now, not only do, our doctors will say, yes, this child does need day treatment, or no, this child does not, or he needs case management. But now that process has changed as far as day treatment. Even though the doctor prescribes that, we now have to enter that into a system with Health Systems of Mississippi. And they decide at that point whether this child is eligible for day treatment or whether he's not, and exactly how many hours of day treatment he gets.
So this is a person, they come in, they evaluated, they are seen by a physician, they are seen by a clinician, they're referred, and then just some black and white data is sent to somewhere. What is it, in the cloud, the iCloud, up in the cloud there somewhere, and then somebody who will only look at that data, and based upon that data will make a decision as to whether this child is appropriate to receive reimbursement for the services that we're providing.
Exactly.
Which that's, that doesn't seem to be the appropriate way to go when you're talking about serving as many as 130,000 people, and a lot of that children throughout the state in the 15 regional community mental health centers. And so that's been quite a challenge, I know, for you and your staff.
Been a huge challenge.
And here, then you have children, you have parents who wonder, well, why isn't my child being served here? Or because I know that really affected our day treatment program in the second half of our day treatment program, which was in July.
Right.
And that was because, parents, you may have a family with 1 or 2 or 3 or 4 children in there, and traditionally, if one gets gone, they all,
Right.
As a rule. So that's interesting, and that's part of the changes that we've been talking about here, and we're going to continue to talk about with Debbie when we come back. We've got a couple other things that are happening, and my guest today is Debbie Brockaway, who is the Regional Children's Coordinator for Singing River Services, and has been doing an excellent job, and a lot of challenges that are going on. Anybody and everybody knows who's watching this program, whether you have a child, you have a nephew, you have a niece or someone like that, understand the challenges that are going on with children in the time in which we live. And let me remind you of the number that you see on the screen there. That number is available to you 24 hours a day, 7 days a week. And if you would like to have more information about our children's program, and we'll come back, we're going to talk about, we even offer free parenting classes, which, is an important thing. Children don't come with instructions as a rule. So we're going to take a break, and we're going to come back. We're going to talk more with Debbie Brockaway about services and about changes and about how that will affect you and how you can get help that you need through Singing River Services right after these messages. Hello, this is Sherman Blackwell, and welcome back to the second half of Singing River Services. Thank you so much for joining us today. I am the Executive Director at Singing River. I have with me today Debbie Brockaway, who is our Regional Children's Coordinator. And before we get back to Debbie, I want to remind you of a couple of things. Last week we had Wanda Bell on the program, and we were talking about the Day of Diversity, which is happening this week. The actual day where we do the recognition of that is, we're doing it the 10th, which is this Wednesday as we are recording this, and the actual day is the 13th. It is a day where we recognize, we talk about, Debbie, as you know, we've talked about Day of Diversity and like it's something new. America's always been diverse. The inception of it, the changes of it, and it's important, to recognize differences. That's what we were founded upon, supposedly. Freedom of speech, freedom of religion, those kinds of things that we hold very dear, and you know, our Declaration of Independence, our Constitution, and those kinds of things. So we just wanted to remind you of that, and if you would like more information about that, you can certainly call the number on the screen, and you can contact Wanda Bell, and she will be glad to assist you and get you information regarding that. I think we really do reduce tensions whenever we begin to understand and we have a dialogue. If you don't have a dialogue, you don't have communication, then you're subject to think about. I said it on our last week's program, 90+%, actually around 93 of what we communicate is meta-communication,
Right.
And only 7% words, and sometimes it's hard to articulate because we've already assessed things because of our sensory perception and because of a lot of different things that go on about an individual. And many times, when we're talking about children today, people will say that about children, well, he's a bad egg, or
Right.
she's from and we have a tendency to do that, and it's hard sometimes to break away from that, but what differentiates us from the animal kingdom, if you will, is the ability to think.
Exactly.
And that's a God-given ability, and that's what we should exercise, the ability to think about what we're going to say, how we're going to act. Doesn't always happen, I don't always do that, but we have that ability to do that, and we should exercise that more. Before the break, we were talking about children and all that. Tell us, I know in Jackson County we offer parenting classes.
We do. We offer parenting classes here. It's free of charge. The times on the parenting classes change
Right.
according to the need. You can just call that number and they will give you,
Absolutely.
they'll
Sometimes
transfer you to someone in children's and they will give you the times. We offer parenting classes, anger management classes for teens, children and teens. We offer drug and alcohol, and like case
lot of
management,
different-
individual therapy, and
Right.
all those services are offered.
What you work up, of course, you do other things in addition to that, but primarily you do that. What do you see, Debbie, as in your tenure there, and I know you work with adults and now you focus on children, what do you see as is there a critical need? And I know looking at a certain demographic or a certain population or a certain geographical location can look different than other parts, but what kind of needs do you see that are arising that need to be addressed when it comes to children of all ages?
Drug and alcohol is number one, probably. It's a need that is really out there that we need more prevention. We need more services for our youth, not just for adults, but for children and youth. That's probably the number one. We need the intervention. Early intervention is a
Yeah.
key as well.
You hit on a good point, because it doesn't matter who may be on the program or what particular program that the agency has that we may talk about. It seems that on some level you can talk about substance abuse, whether you're dealing with individuals with disabilities, whether you're dealing with adults with mental illness, or whether you're dealing with children.
Exactly.
And of course then the substance abuse arena, it seems to be so prevalent, and we've said on this program before, it's so easily accessible. You used to meet the guy, well, I did, but on the corner, you know what I mean, or the drug dealer. You had that, but now it's so readily accessible in the home, in the family. And with the decompensation of the so-called nuclear family, I guess what some people would call the new normal, what do you, because I guess you see, we talked earlier about seeing children, but also seeing, you don't just see mom and dad. Sometimes the home is broken many times, or it may be an aunt, or it may be a grandmother.
Right. Or it could be someone that is not even related to that child that has custody of that child. You're seeing more and more of that, and with that comes a lot of behavior issues. These children act out in different ways, many different ways. Some are very withdrawn. It's very difficult to say this child needs any services because, you know, they're very withdrawn. They don't talk. They don't, you know, but when you look at the overall picture, this child needs socialization skills, you know, that. So you have, with the family decomposing, as you see often, there's all types of behaviors that come out of that situation.
There's got to be a great challenge, I have no doubt, and we do what we can, but you're talking about dealing with a child that has been, I'm talking about a bona fide need. You know, we don't look around trying, but if you children have problems, you got across the whole board, those that may have some kind of organicity to them. If you're talking about autism, 1 in 88 children
Yes.
now with
Yes.
that. Are you talking about behavioral? Are you talking about abuse?
Right.
And then you're dealing with this child for a limited time, and then the child goes back into a certain environment. Unless that environment changes, then it's not going to lend itself to becoming better.
Exactly, and that's where case management comes in
Good.
and tries to put the pieces to say back together with that family, or some type of structure for that family so that child can, because sometimes parents are just not educated to what's going on, and educated to the different behavior disorders that their child may have. Their way of dealing with a certain behavior may not be what is working for that child. And if you have a case manager in that home that can kind of, you know, give insight and maybe even get that parenting classes, some